This is Chris Kittle with a simple demonstration on the first crucial step to our Core Complete system, reestablishing mobility. Now, as we mentioned throughout our presentation, reestablishing proper mobility is crucial to allowing a muscle to tone and strengthen through its full range of motion. In order to demonstrate this, what I've got here is just a rubber band that we use here at the gym for just various purposes. Like we wrote in our article, what we want to do in order to be able to, move a muscle through its full lengthening and contracting range of motion is being able to stretch it out fully. Right? The problem with this is if we have a knot in the center, or not anywhere in the muscle that's developed as a result of poor posture, or the muscle spasming, or whatever it may be, we can't lengthen it as effectively. So this restriction in the band is really precluding me from doing so. So what I have to do first is untie this simply here so I can get full range of motion. Alright, so we've removed the restriction and now we can move the muscle through the full range of motion. We can expect a set result. And by extension, the interesting thing about this is everybody has areas of their body due to daily posture, positions that we get in, whether it be sitting over a computer or sitting, leaning back in our chair, that are restricted, that develop these areas of restriction, these things that we call trigger points. And in order to really address these things first, what we want to do is a couple simple tests in our program to figure out which areas of our body are knotted up. Once we figure that out, we're just going to give you a couple solutions to just deal with that, untie those knots on a daily basis so we can kind of stand upright, we can tone our muscles through the full range of motion, and we can expect optimal results with our program. Now, the first test that we're going to utilize in our program to test the upper body, to look for this kind of desk posture we were talking about, is what we call hands behind back. All right, so what I'm going to do is just ball one hand up into a fist, put it behind my back. All right, ball one hand up into a fist and put it on top, and see how close I can get them together. All right, now if these are less than maybe 10 inches apart, so this hand comes up to about the mid-back, this hand is coming down to around the upper back, right above my shoulder blades, then I'm okay. Okay, this is telling me that I have pretty normal range of motion here. It's not ideal, but by the same token, it's in the range of normality. All right, I'm going to compare this to the other side, okay, and see if they line up. All right, if I find that one side is way down here, all right, the other side is normal, then that is an area of restriction, and that's something that we want to work on a daily basis. Or, if I find that both sides are really knotted up, we're down here, then one of the things that we can do is take a simple tennis ball and release the areas that are kind of knotting those areas up. So in this case, this would be what we call the posterior rotator cuff here. Okay, so what I'm going to do is I'm just going to take the ball, I'm going to place it down here on the floor, I'm going to put this under my armpit here, I'm just going to roll around. All right, I'm looking for a spot of just restriction, any tightness that I feel, and again, you're even going to feel some sort of pain tingling down the arm, and that's just the muscle, the kind of the area of restriction sending signals kind of down that nerve. So I found this spot. All right, now what I want to do, it really hurts and it doesn't feel like it should be there. Right, so it's going to feel tender or sore. What I want to do is just let this thing sink in. All right, I'm just trying to get this thing. Just let this ball sink into this area to press this spot, and I'm just going to hold here for around 2 to 3 minutes. All right, from here, once I've kind of gained range of motion, once I've acquired more range of motion, I've untied the knot, now I want to move the muscle through the full range of motion to help to kind of bring me back to neutral, so when I'm doing these strengthening exercises, I can move my arm fully overhead and do the things necessary to be successful. So what I'm going to do here is what is called an arm sweep. So I'm going to line my side here like this. I'm going to start with my hand under my butt. I'm just going to sweep my arm up and over my head. Okay, again, you might feel your hands start to come off the floor here, but what we're doing is we're just moving the arm into full, what we call abduction and flexion. So I'm really improving the ability of the joint and the muscle itself to come overhead. I'm just trying to gain a little bit of range of motion with each movement. All right, at the same time, I'm just trying to move slowly. I'm just trying to come up to the top. I'm pausing for 1 or 2 seconds. I'm thinking about breathing deep. And I'm just performing around 12 to 15 reps on this side. All right, with this, we're going to prioritize the side restriction. So like if my left side is tighter versus my right side, and I've scored that in our postural testing, I'm going to do more for that side. But the point is, I'm doing this daily rolling, reinforcing range of motion to kind of get this mobility back. Now, for my lower body, one test that we'll employ is what is called hip internal-external rotation. So I'm just going to come up here, right? I'm going to internally rotate my hip as much as or externally rotate my hip as much as I can. I'm going to bring it in here. My foot should be about parallel to my knee here, so it should be here. If I find them down here, okay, that's a problem. By the same token, I want to come out this way. Okay, and again, for me, I've got a bit of an internal rotation deficit. I should be a little bit farther out, about 35 degrees, so about like midway. I'm not, but I'm not. So what I know is that on this side, I'm restricted. I'm going to compare this to the other side. All right, I have a little bit more range of motion, but I know that for me, because I sit in a desk a lot, even though I train, I'm going to take this ball and I'm going to put this under my butt cheek. All right, again, I'm going to find the spot of restriction, cross my leg over the spot and let it sink in. All right, I'm pressing down, and again, I'm just letting this depress this area of restriction. All right, and then from here, I'm just going to, hold for 2 to 3 minutes and then come into what is called a pigeon pose. So I'm here, I'm twisting my hip into internal external rotation for around 12 to 15 reps, kind of working on this new range of motion. But as you can see, those are 2 simple screens that we utilize in our program. We test every 4 weeks, and we just kind of see what areas that we need to work on so we can reinforce this on a daily basis. It's going to help us to stand up straighter. It's going to help us to feel better as well, move better, and ensure that we're getting the proper things necessary to be successful with our program first.